Hey, Dr. C here with you. So what's the difference between adrenal disease and adrenal dysfunction? Really important distinction to make. So adrenal dysfunction, also known as adrenal fatigue, adrenal stress, this is a real thing, and it affects a lot of people and causes a lot of symptoms. And yet it often gets confused with adrenal disease. Some think that adrenal dysfunction is a mild form of adrenal disease, or some wonder if they have an adrenal disease if they have dysfunction. Those are clunky terms, right? Yeah, they're totally different. The basic idea is that adrenal dysfunction is where the adrenal glands can work, but the whole balance that they work under is off. So they're controlled by the hypothalamus and the pituitary, and with dysfunction, they do what they're told. But the system's out of whack. The system's not timed correctly. That's the basic idea. With adrenal disease, they don't do what they're told. They can't work. Either they can't make anything or they're out of control and they make way too much. So that's the high level distinction. And this is important though, because even if someone has adrenal dysfunction, it's worth knowing that it's not that their adrenals are broken. There's someone I'll be talking to in the near term who is on hydrocortisone. That's a synthetic version of an adrenal hormone. And she was put on that because she had very low levels of cortisol. Well, the doctor thought that her body couldn't make cortisol. Now it turns out that by taking hydrocortisone, she's had really bad weight gain and she can't shake it. And it turns out that it wasn't that her body couldn't make it. Her body was choosing not to make it. It's a really big difference. The cortisol levels can look the same, but if the body's doing it on purpose, we want to work with that. Okay, let's talk a little more about some diseases first, then we'll wrap up more about dysfunction and how you know the difference and what to do about it. So for diseases, there's two main things that happen that are diseases that relate to the adrenals, and they correlate with the wrong amount of hormone coming out. Basically, you get way too much or way too little. And when these are diseased, the degree to which the hormone levels are off is not subtle. It's like really marked. So the most common thing is called Addison's disease. And this is just like Hashimoto's, but it's not about the thyroid, it's about the adrenals. It's like Hashimoto's because it's autoimmune. And in this case, the immune system attacks the adrenals and makes it to where they can't make anything. When they work well, the adrenals make more than 57 different hormones. Some of the big ones include cortisol, DHEA, pregnenolone, aldosterone, and these control a lot. They control when we wake and sleep, our blood sugar, our electrolytes in our blood. They control our inflammation levels, and they also affect how other hormones work. Now, with Addison's disease, the immune system wrecks the adrenals, and they can't make much of anything. And this is not subtle. This is rather dramatic. Unlike Hashimoto's, many with Hashimoto's, the immunity can slow the thyroid and render it somewhat inoperative, but it may plug along at like 20, 30, 40% capacity for long term. In the case of Addison's, it's much more typically all or nothing. It's more of a complete shutdown. So yeah, with this state, there's almost no cortisol, aldosterone, DHEA, pregnenolone that's made. And this can be fatal. People can't live long without these hormones. Or if they do, when there's any tiny metabolic stressor, like an illness or a trauma, they can't respond to that. And that can be fatal or just medically catastrophic. So Addison's disease, we suspect that when someone can't control their basic body chemistry. Their electrolytes are leaking out, they get bad swelling and fluid retention, they have horrible exhaustion, they can't control their blood pressure, and on measurement, their cortisol is just about non-measurable. Now, back to Hashimoto's to make this analogy. With Hashimoto's, we measure the hormones coming out of the thyroid, T3 and T4, and we also measure how the brain is talking to the thyroid through the TSH. In the case of Addison's disease, when we suspect this, it's all the same. We measure what comes out of the adrenals, especially the cortisol, and we measure how the brain is talking to them. In that case, the hormone in question is called ACTH. That's adrenal corticotropic hormone. And that one tells the adrenals to work. There's a pretty big range of what they produce, and this one affects all of them rather similarly. So ACTH is just like TSH, but it's of the adrenals, not of the thyroid. So with Addison's disease, the cortisol coming out is very low and the ACTH is extremely high. And what's happening there is the body is begging the adrenals to work, but they can't. So the body has too little. That's a case with the adrenals. You could say they're fatigued, they're worn out, and they can't do anything. So how common is this? Well, this is a few people per million, probably between about 2 to 5 per million in most populations. So quite rare. And many people can have low cortisol but not have Addison's disease. On the opposite end, we have Cushing's disease or Cushing's syndrome. And this is really any situation in which there's way too much cortisol or hormones like cortisol. This can happen from the body not working right, the body's making too much. It can also happen from taking medications that are like cortisol. These are commonly given for acute inflammation, like prednisone for severe arthritis, Kenalog for an asthmatic reaction. These are things that are kind of like cortisol, but the amounts in use are much higher than the body would normally make, and therefore they can have a lot of side effects. So we call all these things Cushing's syndromes. And in these cases, we'll often see high amounts of cortisol. The one caveat is that if someone's taking a synthetic form of cortisol, it may not register as cortisol in the blood, but it'll still show many of the effects of that. So like we see with Addison's, there can also be marked fluid retention, also a thinning of the skin, loss of muscle tissue, hair thinning, insomnia, agitation, anxiety. These are all real common with that. And then, like ACTH is relative to TSH, ACTH levels tend to be extremely low. And this is the body wanting there to be not any more cortisol, trying to get a break from it. So those are the two most common versions of adrenal diseases. There are others, and most of them fall under one of those two categories of too much or too little, but those are the main ones. Now, adrenal dysfunction, more on that. We can call this adrenal stress or whatever, but this is to where the body can make cortisol, but it's deliberately making amounts that are not timed properly. So what this means is that the normal cycle of a lot of cortisol in the morning and shutting it off as the day goes along doesn't work right. And this can look like cortisol levels always being low or always being high or being backward. So any way that cortisol timing is not right, this can be adrenal dysfunction. And it's important to know the adrenals are not broken. So if you see someone that has low levels of cortisol and it's adrenal dysfunction, they're not lacking cortisol. It's not that their body wishes it had cortisol. Their body's trying to get a break from cortisol. And sometimes if you give cortisol, you can force them to have more energy. You can reverse some symptoms in the short term. It's kind of like your car is running badly and you just put some racing fuel in it. You didn't fix the problem. You made it go harder, but now the underlying issues are probably even worse. And so too, when cortisol levels are high, it's not that the body is unable to get rid of it, it's that the regulation is off. So an easy way to distinguish this, if someone's not sure, is to measure ACTH. And this is not done often enough in natural medicine. Quite often they'll see someone that has low cortisol and assume the body can't make cortisol. But in almost all those cases, when we look at ACTH, it's not elevated. It's quite normal or maybe even low. And that's showing that the body's doing it on purpose. And that doesn't mean that it's not real. That doesn't mean that it can't cause symptoms. That doesn't mean that it doesn't make someone feel badly. But it means that the body's trying to get a break from cortisol. The body needs to regroup and rest itself, and there's some chronic thing that's stressing it. So the solution is not to crank up cortisol by cortisol pills or by things that force the body to make more. The solution is to really find the issue and help that rhythm come back again. And when someone doesn't have adrenal disease, the prognosis is really good. In almost all cases, within a few weeks or a few months, they can get a healthy cortisol rhythm back again. And that's pretty awesome. That means that they can have better mental focus, more steady energy, easier time maintaining body weight, healthier sleep at night, and longer term better health. We know that adrenal dysfunction correlates with any chronic disease you could shake a stick at. I mean, no kidding. And also nearly all versions of just unwellness long term. So yeah, much better health, better longevity, fewer risks by correcting that. But important to understand that it's not a disease. And if a well-intentioned practitioner wants you to take cortisol, Get another opinion, push further about that. Ask if your body is low in it on purpose or if your body really can't make it. If this is Addison's disease, is this disease or dysfunction? So super important distinction. The tough part is that natural medicine often doesn't understand this distinction, and then conventional medicine doesn't realize that adrenal dysfunction is real. It is a real thing. A lot of the misconceptions in natural medicine have made conventional medicine just ignore the whole thing outright. But that's not right either. It is real. It can affect your health, and you can do things about it. All right, Dr. C with you. Take great care. We'll talk more real soon.